Imagine neutrons, photons, and electrons whizzing straight at you. Yes, sounds terrifying and dangerous. Yet, when done under the expert care of a radiation oncology team, these same high-energy particles can actually be a weapon in killing cancer cells. It's called radiation therapy. The National Cancer Institute defines radiation therapy as the use of high-energy radiation from X-rays, gamma rays, neutrons, protons, and other sources to kill cancer cells and shrink tumors. These high-energy particles damage the DNA of all cells in the area that is getting radiated. Healthy cells, though, can recover from this damage. Cancer cells cannot, so they either stop growing or die. I'm cancer physical therapy specialist, Dr. Leslie Waltke, and in this episode of The Recovery Room, we are going to visit a radiation oncology center to show you a linear accelerator, the machine that both generates and delivers external beam radiation. Now, observant types will notice that most often the radiation oncology department will be in or on or around the ground floor. This is because the walls, floor, and ceiling of rooms that provide radiation are typically encased in several feet of lead and or concrete. Even the door to the treatment room is thick. This baby weighs about 4,000 pounds, so it comes with its own mechanical open and close button. Thank goodness, because I may be strong, but not that strong. So here is a linear accelerator, which cool people call a LINAC for short. And here is the LINAC table. Though radiation therapists are expert at making you as comfortable as possible, the radiation table still comes with a reputation of generally not being the place you want to hang out to binge a Netflix series. The table is pretty plasticky and narrow, and this is so it doesn't absorb any radiation. Once on the table, it is critical the person is perfectly lined up the same way every time down to the millimeter to ensure that the radiation particles are passing through only the intended area, like the cancer, and not through other areas like the heart, organs, or tissues it's not supposed to. Proper positioning is done with immobilization devices like these to help put your trunk, arms, legs, and head in the same position each time on the table. These lasers that come out of the wall on each side are then lined up to match the radiation tattoos placed on the person's skin to ensure that the person is in the perfect spot under the linear accelerator. Once in position, the person and table do not move. The LINAC can actually rotate 360 degrees and does all the work. The radiation beam comes out of the LINAC, enters the body, exits the body, and then dissipates in the floor or the wall. Just outside of the LINAC room is the control area, where the radiation therapists ensure everything goes to plan. From the control area, they can see and hear the person on the inside. They can also get a look at the computer images of the person, as well as details on the radiation dosing and delivery. This is really amazing technology used to kill cancer cells. Thanks for checking out the linear accelerator with me. Have you had radiation? If you did, how did it go? Let us know in the comments section. Also, I will put the links for the recovery room videos about dealing with the radiation side effects in the description section. I'm Dr. Leslie Waltke, signing out from the recovery room. If you liked this video, please hit the like button, subscribe, and share. Thanks. We'll talk again soon.